Hello. This presentation was part of a invited lecture at the Leading Edge Conference in 2009 at Atlantic City, New Jersey. I begin the presentation by showing two old friends, Barry Goldberg and Harvey Feigenbaum, both leaders in their field of ultrasound in radiology and ultrasound in cardiology. On to atherosclerosis and imaging in real time. I will present a series of slides and movies showing bedside and then back to the bench. Contrast-enhanced ultrasound and carotid vasovasorum imaging. We will then move to quantification, clinical studies, experimental data, and future uses. To begin with, cardiovascular disease is in fact pan-epidemic. What technology are we going to use? Who's going to rescue and make early diagnosis of patients? Who will build it? Who's going to pay for it? And how do patients access health care? Non-invasive imaging, as shown here by Rembrandt and his early Dutch explorers. Ultrasound is portable, goes to the bedside, and is quite inexpensive. As this slide demonstrates, we can image any part of the body, including the carotid, the heart, the kidney, the aorta, with ultrasound, and contrast can be used to enhance the lumen and the perfusion of tissue. The next slide is a series of movie slides actually demonstrating the parts of the body that we've imaged with ultrasound and contrast. So we consider this our cardiovascular prevention center. At the core is the ultrasound system. In the upper left corner is an example of a patient and the different parts of the body, and each corresponding movie shows successive imaging of different parts of the body: heart, carotid, kidney, the IMT, and handheld information systems as long as we can record data from the patient's charts. The next slide is an example of a tumor or atherosclerosis. And as you will note, there's a necrotic core as well as a lining along the lumen surface in this excised carotid plaque from a patient. Exactly how do plaques grow? What makes them survive? It is, in fact, the blood vessels, or the vasovasorum, that actually penetrate the wall of the artery into the media and intima surface, providing the tumors or the abnormal growth with new blood vessels. As seen in this series of photographs from 1991, this is from an autopsy sequence where the coronary artery is highlighted here, or the luminogram is well seen from a silicon high-pressure injection. The plaque is noted here with a piece of calcium in it, and as you progress from the left to the right, you'll notice that the vasculature is actually bathing the plaque. So this is very much an angiogenesis-based atherosclerotic tumor in this autopsy specimen. An early marker of preclinical atherosclerosis is the vasovasorum, as identified by Biedermann. In these series of quotes on this slide, taken from her paper from Fleiner et al. In 2004, she described that the vasovasorum is actually an early sign of atherosclerosis and occurs prior to the development of IMT thickness. This slide is our very first example in 2003 of a human carotid artery with contrast ultrasound demonstrating angiogenesis in an atherosclerotic plaque. As you can see on the surface of the carotid artery, the vasovasorum lining can be identified. However, within the tumor itself, or the atherosclerotic plaque, you can see evidence of contrast agents circulating. The next series of slides will show the clinical pathologic correlates to the carotid plaque angiogenesis that I've demonstrated. This again is a histologic sample from a patient who had a carotid artery atherosclerotic plaque surgically removed. As you can see on the left part of the slide, that's the lumen and a corresponding necrotic core. There are cholesterol crystals also seen. as we begin to look inside the plaque itself, into the matrix of the plaque, we can identify many irregularly shaped vasculature. These are endothelial-lined angiogenic vessels. You can note there are 2 red cells trapped inside one vessel in the center right screen. Of note, in the upper left corner where it's marked hemosiderin deposits, you can note there's a brownish stain in the matrix without evidence of angiogenic vessels. Using the same slide series, but staining with CD31, which is a mouse autoantibody to human endothelial cells, you can note there's a growth of endothelial vessels and new vasculature throughout the atherosclerotic plaque. And an important stain is the hemosiderin stain identifying iron deposits within the plaque. What this indicates is that when the plaques rupture and the red cells actually extrude from the vasovasorum vessels, the iron within the hemoglobin is deposited in the tumor itself or the plaque and remains there permanently and can be later stained with hemosiderin. This graph demonstrates a recent publication in 2007 from the Journal of Vascular Medicine in which we compared and correlated the ultrasound contrast angiogenesis to the histologic examples from the tissue specimen. What you can see is that the histology correlated very well with the visual quantitation of angiogenesis noted within the specimen in 17 specimen or 15 patients. This next view is an open vasculature exposure during surgery taken from Stroke 2007 and Vincenzi's article. What you see on the middle left is the common carotid, then bifurcating into both the internal and the external carotid. Please note the surface of the artery itself is filled with small wisp-like vessels. These are in fact angiogenic vessels. And another view from the same paper in 2007 reveals the standard carotid imaging in A, then B with color Doppler, and C with contrast enhanced ultrasound. Note that within the plaque itself are the small microspheres. And finally, from the same paper of Stroke 2007, another example of the contrast enhanced carotid in A, and in B you can see the microvasculature, and C, of course, at the time of surgery. This is a patient taken from our laboratory at Rush University Medical Center in Chicago. It's a patient who has a graft in the carotid artery. What you'll note is there's very little angiogenesis within the dark luminal structures. These, in fact, represent the arterial grafts. However, on the next slide, proximal to the bifurcation, you can see vast amounts of angiogenesis lining the arterial surface of the artery while the contrast flows through the lumen itself.